Dear George, a new ebook has been published. We worked on this ebook together with many friends from all over the world for over 2 years. The Foundation of Oral Rehabilitation made the publication possible, and anyone who logs into their account can view and read it. It is free to use for anyone interested in the topic, whether they are students, dentists, or interested in the content for any other reason. Here we see the first page of the book and its title, On Treatment Planning Prosthodontic Patients, a Case History Series. We also see a picture, a seminar working group at work. This picture refers to the history of this book, and this history is certainly as interesting as the book itself. It all started with an idea from you and my predecessor in the Dental Academy of Karlsruhe, Michael Heners. You wanted to set up a workshop aimed at young prosthodontic educators from all over the world to teach them how to approach prosthodontic treatment planning in a careful, professional, and aesthetically sound manner. In 2006, the first workshop took place at the Dental Academy in Karlsruhe. It received an overwhelmingly positive response. Colleagues from the editorial board of the International Journal of Prosthodontics, of which you were editor-in-chief for many years, formed the teaching staff. As the successor of Michael Heners, I have helped to run 10 workshops with you from 2008 to 2018 in Karlsruhe, Seoul, Beijing, and Kyoto. George, what is the core focus of this workshop? Why does prosthodontic training worldwide need the approach taught in the workshop?
Well, with invaluable help from a small and unique international cohort of clinical educators, Winfried Walther and I promoted a prosthodontic educational ethos which reconciles patient concerns and hopes with evidence-based treatment outcome challenges and determinants. We address them in the context of two compelling commitments. First, our commitment to addressing patient treatment motivation, which is comprised of 4 principles: to live and function normally, if possible, to be free of pain or other physical, psychological, or social symptoms, to be free of treatment-related iatrogenic problems, and finally, to remain financially solvent. There was also a second objective, and that is frank acknowledgement of our clinical challenges. We prosthodontists do not cure oral diseases. We manage the consequences, the sequelae, by using numerous ingenious salvage-type interventions. Our therapeutic interventions may also risk inducing adverse intraoral ecological changes at specific interfaces, which clinical prosthodontic scholarship seeks to control. We therefore, with the help of our colleagues from around the world, chose to underscore treatment planning concerns via interaction-specific prosthodontic interfaces, knowing very well that scholarly returns from the study of the cited interfaces can only enrich the intellectual, cultural climate that is needed for both graduate students and future clinical educators. Our approach defined the discipline's scholarly mandate for managing patients' oral rehabilitative needs, and the e-book's 3 introductory essays review salient and background features of each cited interface to provoke and enrich seminar debate on treatment planning decisions for the selected workshop cases. I'd remind you that the traditional prosthodontic scholarship has focused on controlling specific interfaces. First, dentition's occlusal surfaces, hard and soft tissue responses to restorative materials, and more recently, the magic of dental implants. Second, neuroscience and oral rehabilitation, and third, the patient-dentist interface. Clinical educators need to acknowledge that prosthodontic discipline remains at a crossroads in its long-standing claim to both define and lead intraoral architectural initiatives. Our collective effort to promote an educational ethos that offers scope for a far more eclectic global teaching template was the underpinnings of our workshop's remit. It provides an alternative to emphasis on show and tell efforts in the training of clinical educators while enhancing their potential to sustain leadership in the discipline. More from you, Winfried, about the ebook's content.
Yeah, but I think to understand the purpose of the ebook, we should now take a look at the case series that forms the last chapter of the ebook. We see the case selection. Each case is presented with a list of keywords, an X-ray image, and a graphical overview of the findings. Clicking on the button below with the planning case takes you to the actual case description. These cases were presented in workshops for young prosthodontic educators and discussed by learning groups. On the last day of the workshop, the groups presented the treatment they had chosen to solve the case. The cases come from all over the world and have not been standardized by the editors. This collection of cases can be used in prosthodontic teaching. The e-book makes this collection available to anyone who wants to use the educational tool of case studies. We highly recommend taking advantage of this opportunity. You are invited to have a look, make your choice, and use any case history you like for teaching or for learning.